subscribe now and press the bell icon. Never miss an update.
Welcome to Health Live at Seniors Today. We are delighted to have here with us Dr. Pujan Parikh, who is a consultant pulmonologist and sleep medicine specialist at the Sir H.N. Reliance Foundation Hospital and Research Center in Mumbai. A little about Dr. Parikh. He has done his MD in Pulmonary Medicine from the BJ Medical College, and he's done his fellowship in sleep medicine in FCCS. He has many international publications to his credit, international and national, and he has received training in Fiberoptic Bronchoscopy, Bronchoalveolar lavage, lung biopsy, Ebus guided TBNA, and he has a special interest in sleep medicine. The reason why we have Dr. Parikh here is, of course, we are aware of the fact that the COVID pandemic seems to be rising once again. We hear news of the fact that the number of cases in COVID wards has increased. And given all of that, we thought it would be good to have Dr. Parikh here, who is a specialist in respiratory medicine. And given the fact that COVID does impact the lungs, etc. So, Dr. Parikh, I would request you to enlighten us as to what is happening right now. And then we will open it up to questions by the audience. But first of all, Dr. Parikh, while welcoming you, what is the situation right now on ground in terms of you are at the H.N. Reliance Hospital, which used to be a non-COVID hospital, but I'm sure you are aware of what the situation is elsewhere.
Yes, so good evening, everyone. Can you hear me?
Yes, we can hear you.
Okay, so basically HN is a non-COVID facility, but they have a tie-up with the Seven Hills Hospital, and we have around 100 beds at Seven Hills Hospital managed by HN Hospital only. So I'm working at both the places. So definitely the number of cases have gone up since last 1 month. In between, say, in the month of April and May, there were hardly any patients of COVID, but since last 1 month, it has gone up significantly. However, I can tell you one thing, that those who are vaccinated don't get into any major trouble. Most of the patients are stable, and very few patients are requiring oxygen. I've worked in all the waves, first, second, and the third wave. So definitely during first and second wave, we were not having vaccines, and at that time, from all the age group of patients, they were requiring, many of the patients were requiring oxygen. But since third wave onwards, the oxygen requirement is hardly there. So vaccination has definitely helped. Along with that, the viral strain has also is less severe compared to the earlier Delta strains. So that is also one of the change. So definitely the numbers are more, but the symptoms are very mild, hardly 2 to 3 days of sore throat and fever.
Doctor, one of the issues that is there is that people are getting their tests done, their home tests done, and are not really reporting it to anyone. More because of the fact that in cities like Mumbai and Delhi, etc., where there are people living in housing complexes, it basically means that you are isolated totally from the world. Is that something that is a good thing to do, or is it okay if you don't let people know and just isolate yourself?
So that is fine. See, ideally it should be reported, because depending on the number of cases, only the government decides the further and the future plan of action. Okay, so that's why reporting is very important. However, if someone is don't want to report it, but if they are isolating and quarantine themselves, then that is also one of the important thing to prevent the further spread of the virus. But definitely the reporting is important. One more advantage of doing the proper RT-PCR sometimes is what happens if you have if a person turns positive and has a positive report RT-PCR, and in case suppose they need a hospitalization, that becomes very easy and convenient, because if you just have a rat report, or if you one of the family member is positive and you others has got the similar symptoms and you don't do it the test, then sometimes in case of emergency, you will have to go to a facility where where maybe they are not providing COVID care. So that is also advantage of doing the RT-PCR if the COVID is suspected. Definitely in those who are immunocompromised and the age is more than 60 years, for them specifically.
In fact, one of the things with the rat is I just got somebody to send me the rat report, and the second line which comes on the report, which comes on the image, is very mild. Now the thing is, in terms of reading it right, is it if the second line that is there is very light, is it a negative or is it a positive?
No, okay. So if you have two lines, which is if you are seeing two lines, that means it is positive. If you are seeing one line, that means it's negative.
But if you're seeing the second line, which is very faint.
So it doesn't matter what happens. It depends on what time of the infection period you are doing it. It depends on the viral load as well. If you are doing when the virus load is more, then the second line may come more darker compared to the control. And if you are doing very late or very early, then that line will come faint. So if you are seeing two lines, that means it's positive.
But an RT-PCR is what is recommended always, because you can use the facilities of the government or of the local corporation or whatever.
Yes. So.
Right. Over to you, Doctor, for the session that we have, which is basically on COVID care and given asthma, that and the lungs that are impacted so much in this. Of course, you mentioned that the impact is not as much in this phase as in the last wave. So over to you, Doctor, for your opening remarks. And those of you who have questions, please put them as always in the Q&A tab with your age and gender, and we would pose them to Dr. Parikh after his opening remarks.
Sure. So I will I have prepared few slides that gives us a basic idea about asthma, COVID, and a few questions also I have tried to put. So we'll discuss that first, and then we'll take a question and answer.
Yeah. You can share your screen now.
Yes, thanks.
Yes, Doctor, visible.
Okay, so we'll discuss about COVID and asthma basically. So asthma, as all of us knows, that it is an inflammatory condition of the airways, and which leads to wheezing, the whistling sound from the lungs, breathing difficulty, cough, chest tightness, and it is more particularly in the early morning and in the night time. So this is basically an inflammatory disease. There are certain triggers which causes the inflammation and hyperreactivation of the airways and causes the cough and breathlessness. So certain common allergens are dust mites, which is very common in India. Many of us are allergic to dust. Then pollens, then various pollutants, then irritants like perfume, smoke, then certain medicines which we use for hypertension like beta blocker, then the blood thinner like ecosprin, aspirin, which we call it commonly, can also trigger asthma in some of the patients. And obviously the cold air also is a triggering factor. Reflux disease, any viral or bacterial infection is definitely a trigger factor for asthma. Stress is also one of the important factor which triggers the asthma. So in this diagram, and you can see that various trigger factors are there. So smoke, and one more important is the pets. So those who have a cat or a dog at home, that can also the skin of that dog or a cat has certain irritants which can cause asthma to trigger. The fungus, which is also one of the important factor, which because of the monsoon season, is also a aggravating factor and triggering factor for asthma. So various factors affects our asthma development basically. So host factor is the genetic predisposition. Those who have a family history of asthma, then allergy history, then obesity can also increase the risk of asthma. Outdoor allergens, as we discussed, air pollution, diet. So in diet, particularly, some people are allergic to certain colors, as well as say in Chinese diet, some are allergic to Ajinomoto. So this can also trigger asthma. Then any respiratory infection. So this is a basic diagram I have shown to describe the asthma. So what happens? Any allergens, as I discussed, cause the inflammation of the airways, the swelling of the airways, and which can lead to the symptoms like cough, wheezing, breathing difficulty, chest tightness, and this is how the asthma is triggered. Now, few things about COVID. So everyone knows about what is COVID. It was first found in China in 2019. And so basically COVID stands for coronavirus disease. And it has the same family of viruses as a SARS infection, which was found in the early 2020, in the year of 2000 to 2005. Then WHO declared it as a pandemic on March 11, 2020. And the first case, as everyone knows, that reported in China. And as per the reports and the papers which we have, we know that it came first in the early part of December 2019. Some are linking it to the market in Wuhan, and some are linking it to the lab. So we don't know the exact origin. So Wuhan is basically a center from where this virus has come, and this is the fifth documented pandemic since 1918 flu pandemic. So this coronavirus is basically a respiratory virus. It affects the respiratory systems. So the speciality means the difference of this virus is it can affect any organ. Basically, it can affect brain, it can affect heart, it can affect kidney. So it can cause blood clotting. So this is not only a respiratory virus, but the special thing about this COVID-19 is it can affect any organ. Primarily is the respiratory system. So the more common symptoms are the cold, sore throat, and fever. So usually this is found in bats and other wild animals and transmitted to humans by the droplet form. So there is a difference between droplets and the other respiratory spread of infection. The droplets comes in the form when person coughs or sneeze. So when person is speaking, the droplet is usually not formed. Droplets is when the virus is attached to the respiratory secretions. So this is what at that time we call it as a respiratory droplet. So as I told you, it's a transmission occurs via respiratory droplets from coughing and sneezing. And since droplets are heavy and bigger in size, it cannot travel more than 6 feet. And it is detectable for up to 72 hours on some surface, despite decreasing the infectivity over the time. So it can survive for hours, as I told you, and washing with soap or detergent will remove the virus. An incubation period of the infection is usually 5 to 6 days, but it ranges from 1 to 14 days. It depends on the immunity of the patient. Those who are immunocompromised, those who are on steroids, have malignancy, diabetes, they get easy infection. So according to one study, each person infected passes the virus on to average of 3 other persons. So these are some of the common symptoms I've tried to show in the diagrammatic form. So shortness of breath, breathing difficulty, high-grade fever, diarrhea, coughing, vomiting, pneumonia. So most important and the distinguished symptoms, as everyone knows, is the loss of taste and smell. The others are bit of a vague, like a viral infection, headache, body ache, fatigue, uh, the sore throat, runny nose, are the symptoms, the fever. So what I've seen in the third wave and now recently when the number of cases have gone up, so sore throat is the most common symptoms which I have found in most of the patients, sore throat and cold. Fever comes in 1 of 3 patients and it usually settles down with a symptomatic treatment. Hardly few patients required any antiviral support. There is no requirement of monoclonal antibody. Even those who have a renal transplant or a liver transplant, we have treated them without any specific antiviral requirement. So, and most of the patients settle down with the symptomatic treatment only. One of the other features in the person who are 70 or 80 plus, that they suddenly start responding less. Basically, they sleep more, they become bit drowsy, and they start getting some confusion. This is also one of the symptoms of COVID in elderly. So diagnostic test, as everyone knows, it's a throat swab for COVID. RT-PCR is the most gold standard than the rapid antigen test. The sensitivity and the specificity of RT-PCR is much more compared to the rapid antigen test. The advantage of rapid antigen test is we get the result immediately. The disadvantage is we can't differentiate between which type of strain is this, while certain labs give us, when we do RT-PCR, give us the basic idea that is it a Delta wave or a Omicron type of wave virus. Then the third diagnostic test is the CT scan. It is not required nowadays because post-vaccination, what I have seen is the lung involvement is quite less. So CT findings are almost negligible. And since patients are not requiring oxygen as well, so we are not doing it nowadays frequently. But earlier, during the first and the second wave, we found CT scan were very helpful in diagnosis of COVID, because sometimes the RT-PCR takes 24 to 48 hours, depending on the facility which we have. The CT scan, we get the report and the images almost within, say, 5 to 6 hours. So we'll talk about the prevention. As everyone knows that the hand washing is very important. Hand washing with a simple soap and water or using a sanitizer. Avoid contact with a person who has a COVID-like symptoms. Don't touch your eyes, nose, mouth with unwashed hands. Then if a person is infected, then it is advisable to stay at home, avoid contact with others, cover your mouth and nose while sneezing, coughing, and wear mask is the most important advice, because it significantly reduces the risk of transmission and infection to others. 6 feet safe distancing is recommended, as I showed you earlier that droplets usually don't travel more than 6 feet. But this is when the person is coughing or sneezing. But otherwise also, apart from the 6 feet distancing, try to avoid touching unnecessary the other objects, because that can also has a potential to transmit the infection. So that's why the hand washing with simple soap or water and using the sanitizer is important. So this was the study is of May 30, 2020. So what they found in US that around 18% of hospitalized patients had a chronic lung disease. So apart from the diabetes and the heart disease, the lung disease, those who had a predisposing chronic lung disease had a higher risk of hospitalization. So, one second. Okay, so what is the risk basically with the coronavirus and the asthma? So initially, everyone was thinking that the risk is more since the person has already predisposing lung disease. However, recent studies shows that it is the risk is not that much as we were thinking earlier. And if person is already vaccinated, then the risk reduces significantly. So these are the few questions I have kept that are people with asthma are at increased risk of contacting COVID-19. So I have tried to get the data from as much as studies possible. So most of the studies says no. The risk of contacting COVID infection is not doesn't increase in the patient who are already asthmatic. Yes, the risk of hospitalization may increase those who have a moderate to severe asthma or those who have an uncontrolled asthma. So Canadian Thoracic Society had also suggested that it doesn't seem to increase the risk of COVID infection in already person having asthma. In British Thoracic Society said that it remains unclear whether the asthma is a risk factor for COVID-19 and COVID-19 related complications. So we will get more data as the year passes by, but now the oxygen requirement is not there, so it doesn't make much difference. But what I have seen in my clinical practice that those who have asthma, asthma itself doesn't increase the risk of COVID infection. But yes, definitely those who have asthma, then COVID virus acts as a say agent causing the inflammation of airways and increase the risk of exacerbation of asthma. So our patient with asthma at risk of having an exacerbation triggered by COVID-19. So yes, so as I told you that it can trigger asthma like any other respiratory viruses. So how can you tell the difference between the asthma attack and the COVID-19? So in simple words, if you ask me, then loss of taste and loss of smell are the two typical symptoms of COVID-19. Fever is also a distinguishing feature. However, fever can occur and happen with the asthma exacerbation if some other virus is the causing agent of asthma attack. So clinically, the loss of taste and smell, that's what I suggest. But what the literature is saying is the main difference they suggested as a fever. So fever is also something which we have to keep in mind. COVID, if a person has asthma and gets fever, then COVID-19 is more likely than the direct asthma exacerbation. So COVID-19 also often comes with fever, body ache, loss of taste or smell, which does help distinguish it from worsening asthma. Definitely now we have a rapid antigen test, so we can do that and differentiate easily and more quickly. So those who are on inhaled steroids in asthma are okay to use, or should you discontinue them? So the study says that yes, you should carry on taking all your usual asthma treatment, and it's very important to continue managing your asthma well. One of the reason is if the asthma is uncontrolled and if you need to visit a hospital for asthma treatment, then definitely the risk of getting COVID infection also increases over there, because in emergency room or in once the patient is hospitalized, we don't know who else are infected with COVID-19, though definitely we segregate them and isolate them once we come to know. But by the time we come to know, it may be 6-7 hours, and that is good enough to get the infection. So people must continue to take their asthma medication as usual during the pandemic. And yes, so ACAAI suggests that there is no evidence that asthma medication will increase the risk of contracting the virus or worsen the outcome of COVID-19. The reason is some people would think that since the inhaler contains the steroids, steroid is basically a agent which reduces the immunity. So by reducing the that, are we at more risk of getting COVID-19 infection? So the answer is no. In fact, it helps to control the asthma. So controlling asthma is more important, because if a person with asthma gets the viral infection, the risk of exacerbation increases. Should oral steroids still be continued to treat the asthma exacerbation? The answer is yes. So here also the initially they were thinking that when you start giving the steroids, the immunity goes down and the virus will multiply more rapidly. But see, we have given patients steroids for the COVID infection as well. Once the 5 or 6 days of COVID infection is done, and those who are requiring oxygen, they get the organizing pneumonia, and to treat that, we need to give the steroid to reduce the inflammation. So there is no contraindication for giving the oral steroids. So should I use my nebulizer or spacer for relief if I am worried I might have a coronavirus or my asthma is bad? So those who has asthma and gets the COVID should not use a nebulizer. The reason is when we give the nebulizer, the vapors go out from the mask, and that vapors can spread the infection more rapidly. So instead of using a nebulizer, using an inhaler with a spacer is a good idea. Definitely those who need and those who are in very bad shape clinically, we do give a nebulizer. But at home, if someone is requiring a nebulizer, I will suggest them to avoid it, because it increases the risk of transmission to others. So in our hospital, we have one protocol also. We don't give steam as well to the patient who are admitted. The reason is it depends on the environment where you are admitted. So if it is centralized AC, then steam and the nebulizer can aggravate the spread of infection to other patients. So definitely all patients are COVID, but there are working staff, those who are COVID negative, they are also at a risk of infection if we give the nebulizer. So this is recommendation by WHO and most of the respiratory leading respiratory societies. So nebulization is an aerosol generating medical procedure that can increase the risk of aerolization of the virus and infection transmission. A meter dose inhaler with valve holding chamber or a dry powder inhaler is like rota caps is strongly preferred over nebulization, particularly in the healthcare settings. One more question is if someone is asthmatic and they couldn't do a breathing test to determine the severity, since last 2 to 3 years, patients are a bit worried that shall I get the lung function test done, but if I go for a test, then is there an increased risk of infection? So definitely there is an increased risk of infection. So in our hospital, we have made a protocol that we do a pulmonary function test, that is spirometry, only after patient is negative for COVID RT-PCR. So it depends on where you are doing it, but definitely there is a risk. More specifically, you should avoid all this during the ongoing wave. But if you have a negative report and the setting where you are planning to do a pulmonary function test are taking only COVID negative patient, then definitely you can go ahead with that. Now, the other option which we have is a peak flow meter. That is the small device. Those who are asthmatic must be knowing it. So they have to blow into that device, and that device basically, depending on the flow, we can determine about the exacerbation of asthma. Suppose if someone is exhaling at around 300 flow. So if that flow gradually goes down to say 250, 200 or 180, then it shows that there is a risk of exacerbation. Okay, so do I follow the same public health precaution? Definitely, yes. You should wear a mask. You should get vaccinated. Booster is very important, covering your nose and mouth while coughing and sneezing, washing hands, using sanitizer, or simply by soap and warm water is also sufficient. Cleaning your surroundings frequently. Risk of severe infection from COVID-19. So people with moderate to severe or uncontrolled asthma are more likely to be hospitalized. There's a difference between a hospitalization and the infection. So asthma doesn't increase the risk of infection, but uncontrolled and moderate to severe asthma patient, if they get the COVID-19 infection, risk of hospitalization post-infection increases. Follow your asthma action plan. Keep your asthma under control by following the asthma control plan. Avoid the triggers, as I mentioned earlier. And everyone has a different trigger. So they most of them are asthmatic patients are aware about that, about their triggers. So they should avoid that. Continue the current medication, including inhaler with steroids or whatever your doctor has suggested. Do not stop any medication or change your asthma treatment plan. And talk to your healthcare provider about creating an emergency supply of prescription medication, and be careful around cleaning agents and disinfection. So I will come about this point while be careful about the cleaning agents and the disinfection. So that is there in the next slide. I will tell you why I have said that. So follow the recommendation to reduce your chance of asthma attacks. So if a person is having asthma, and they should not clean or disinfect the surfaces and object by themselves. The reason is disinfectants or cleaners, whatever we call it, can also trigger asthma. So there are certain chemicals like bleach can also aggravate the asthma. There is a strong smell. The strong smell can also increase the risk of exacerbation. So they themselves should not do all these things, cleaning part basically. They have to tell someone to do it, and if they should not sit in the same room as well while cleaning is going on. So this is very important. We have seen certain patients who have got the asthma exacerbation because of repeated or too much exposure to all this disinfectant. So the person cleaning and disinfecting should choose disinfectant that are less likely to cause an asthma attack, such as hydrogen peroxide, not stronger than 3%. We get it in 3% and 5%. So 3% is good enough, and or ethanol. Both are usually safe, and ensure that this hydrogen peroxide, when we are using it, does not contain any other chemicals that can trigger the asthma attacks, and limit the use of chemicals that can trigger the asthma attacks, such as bleach, as I told you earlier, or ammonium compounds, benzyl called chloride, and do not use them in specifically when enclosed spaces, when windows and everything is closed. Should avoid that. Use products safely and correctly. So always read and follow the direction on the product label. Wear skin protection, gloves, and eye protection. Make sure there is enough airflow. Keep windows open. Use only the amount recommended. Use water at room temperature for dilution. Do not mix chemical products, and spray or products onto the cleaning cloth or paper instead of spraying the product directly onto the cleaning surface. This is also important. But ideally, what I suggest is those who have asthma should not do all these things, because it definitely increases the risk of exacerbation. Now, see, all this increases the stress and the anxiety, and stress and anxiety itself is a triggering factor for asthma exacerbation. So that is, to control the stress and reduce the anxiety is also the important thing. So about vaccination, being vaccinated lowers your risk for severe illness, and definitely I've seen that this, because during the first and the second wave, there were many patients were requiring hospitalization, many were requiring the oxygenation. We had around 80 patients in the ward, and during the second wave, and out of that, around 20 to 30 patients were requiring oxygen at that time in the second wave. And now this time, we don't have a single patient in ward requiring oxygen, and in ICU also, say ICU requirement is also very less, and then even in ICU the oxygen requirement is very less. So initially, everyone must have heard that some patients were requiring 10 liters, 15 liters. So definitely not that kind of oxygen requirement is there now. So thank you. With this, I conclude my speech and open for the questions.
Thank you very much, Dr. Parikh. You have answered most of the questions that could be there. I'm just going to stop your screen share.
Yes.
Yeah. Thank you very much. So we have a question from Brijendra Kumar, who is 77, and he asks, is there any risk associated with a booster dose?
So if you are asking me about asthma, then no, booster dose is in fact useful for those who are asthmatic. But there are certain patients who has got an autoimmune reaction sort of, or a rash or allergic reaction post vaccination, first and the second dose. So those who have that issue and which is very severe, then definitely can avoid that. But if it is a clinical judgment and call, not a direct answer yes or no. But from asthma point of view, I will say that booster is definitely useful. Should take care.
Doctor, there's a question about after how long after the a COVID attack can one take a booster dose?
Okay, so after approximately 3 months, you can take the booster.
Even if one was eligible for a booster at a certain time?
Yes, after 3 months, we can give. So the reason why we keep a gap of at least 3 months is booster is basically to boost our immunity against the virus, the antibody. So if someone is already infected, and then immediately giving the booster is of no use.
Doctor, there's a question which has come in from an anonymous attendee who asks, what are the exercises that one must do to ensure that even if one is not an asthmatic, but has certain wheezing issues, and especially in the cold season, what are the exercises one must take?
Okay, so simple breathing exercise like pranayama is useful. But see, the wheezing is basically when our windpipes gets narrowed. Okay, so those who get the attack will not be able to do a deep breathing exercise. So simple pranayama is useful, but wheezing is entirely a different thing that occurs because of the swelling of the airways. So we have to figure out why the swelling has occurred. So basically the inflammation. So what are the triggering factors? Once we treat that, then that will help us more rather than the simple breathing exercise.
Doctor, there is somebody who's asked about the inhalers, and this is not exactly a COVID-related question, but should one always have an inhaler with oneself if one is an asthmatic?
So it depends on the severity of asthma. If it is a mild asthma, then severity as well as the triggering factor. So some patients get triggered during monsoon and the winter season. Other times they are fine. So they can, it's fine if they don't use it for entire 12 months. Second thing is the pulmonary function test. If your pulmonary function test is showing that there is no worsening in the lung function, even if you are using inhaler for only a few months, then also you can continue doing the same practice.
All right. And Doctor, one more question that has come in is about, are there any post-COVID, are there people who could develop some kind of asthmatic reaction?
Okay.
Some kind of asthmatic reaction
Huh.
Post-COVID.
Yes, so definitely we call it as a reactive airway disease. So that can happen post COVID. So it is not exactly asthma, it is a reactive airway disease. But if it stays for long, say if it stays for more than a year, then we label later on as a bronchial asthma.
Right. Great, Doctor. Thank you very much for, you have answered actually most of the questions, which is why some of the questions that have come in, I'm not repeating them over here. Your Q&A in the presentation was fairly informative. Thank you once again, Dr. Pujan Parikh, for this session of Health Live at Seniors Today and spending quality time and giving a very informative presentation. Those of you who are here would be aware of the various events that we do at Seniors Today. We would love to know from you what you think about the events and what you would like us to conduct in future. In the chat window, we are putting in a small link where you can look at the survey and answer the questions, and perhaps we would be able to give you something more meaningful. You are also aware that Seniors Have Talent. The season 8 is going to start from August 17th. And those of you who have witnessed it earlier know how much fun it is. It is only meant for senior citizens, that is people above the age of 60. I'm not going to have the video shown once again, but the latest issue of Seniors Today is here. It's there, available on the website, that is seniorstoday.in. And there's a special article on heart care for seniors by Dr. Eric Burgess. Okay, Dr. Eric Burgess, as we know, is a very renowned heart surgeon, heart specialist, and he has written this article. And of course, all our regular features that are part of Seniors Today. So once again, thank you, Dr. Parikh, for this session. We would look forward to having you once again. I know sleep medicine is one of your specializations, but just this topic took center stage, and we couldn't really discuss this. But we will have you once again for sleep medicine. Doctor, there's one more question which has come in, and I think it's an important one. Yeah. Sorry, after booster dose, will one more dose be required?
Okay, so see, as of now, we have not finished with all the booster doses, and studies are going on. Maybe like just a flu vaccine, which is recommended in say west part of the world, that they advise to take yearly flu vaccine. We may get into this sort of scenario that we may need a booster every year. But to answer this right now, it is a debatable thing, and the future in future we will come to know whether it's required or not. Because see, now the strains are changing, and if the infectivity is less, then definitely we can avoid that. But definitely, as a chest physician, we recommend other flu vaccine every year to our patients. So maybe for those who are a high risk, booster may be required, not for everyone.
And the flu vaccine is good for everybody above the age of
60. Yes. 60, 50 or 60. Basically, 60 is more because the immunity and other things, comorbidity increases after 60. So,
right. There's a question from Dr. Sham Mahajan who asks, can asthma patients have alcohol?
So, see, it has nothing to do with alcohol, and it's nothing to do with asthma. So, it is more related to liver sort of thing. It is not an aggravating factor or a triggering factor. But definitely, as everyone knows, should avoid it.
Doctor, how many times are you asked this question by people?
Very few.
Very few, which is a good sign. Very few people asking this question. Perhaps they get scared of your,
yes,
of your possible response. Just one last question. Dr. K. Taras asks, does addition of Montelukast in all asthmatics help to prevent COVID admissions?
No. So we don't have any study for that, and it is not proven. So Montelukast is not a thing which we can give and which will prevent the virus infection.
Thank you once again, Dr. Parikh, for these additional questions that have come in. Those of you who are regulars are aware that this session, the edited video and takeaways will be there on seniorstoday.in on Monday and Tuesday on our website in the webinar section as well as on the homepage. So you can, if you've missed it, if you've come in late, or if you just want to see it again, please come on the website and watch the entire video once again. Thank you very much once again, Dr. Parikh. Thank you for this session, very informative session. And see you again next Saturday at 5 p.m. for another session of Health Live at Seniors Today. Thank you.
Thank you, everyone.
Subscribe now and press the bell icon. Never miss an update.